35-year-old female fell down and broke the leg. Right. And they said there was a lot of blood on the scene. And the patient was taken to the emergency room. In the emergency room, X-ray shows some fracture. Right, we have a fracture. And you check your lab, H&H, hemoglobin, and hematocrit of 7.21. And so they want to transfuse this patient. So transfusion indicated, right? The blood that they brought was the donor of the NCA negative blood. So number one, the transfusion protocol. The protocol is based on one thing. Okay. The antibody of the recipient will react to the antigen. You don't need to memorize any table. If somebody told you, memorize this table, ignore it. This is the only thing you need to know. The antibody of the recipient, if I'm getting the blood, my antibody will react with the antigen. That means my antibody, which is BA, should make sure it does not match with the big A. Little b should not match with B. That's all. So which of those patients will be able to get blood from A negative patient? Remember, A negative patient has B antibody, right? At the same time, you have to know one more thing. The resource negative, okay, can donate blood to resource positive or resource negative patient. So I've given you much information, much content here, then you can answer and see if A negative patient can give blood to A positive, B negative, AB positive, and or O negative. You don't have to memorize it. So which one do you think? Which of these reaction transfusion protocol is acceptable? Always O is a universal donor. So it's a universal donor. Okay. And AB is a universal recipient. So that's the two clues that you can use to answer the question. Therefore, you know that at least, this patient is acceptable. That patient is acceptable. There is no antibody. Antibody here is B. It does not match with the antigen. So A is also acceptable. B as antibody, what? A. It can react with the antigen of A. So therefore, this is not good. Right? A O does not have antigen, but it has antibody B and AB. It can react with A, so it can get blood from it. So the only two people is the AB positive and A negative. Those are the ones that can receive blood from this patient. Your team, you have a RNA, you have a RN, you have a UAP. We have. So which of these actions or assignment is appropriate? Okay, so you have 1, 2, 3, 4, 5, and 9 of them. UAP going for the blood is okay. There's nothing wrong with it. The blood can be transfused usually 1 to 2 hours, but it should not go more than 4 hours. So 2 hours is fine. Blood transfused within an hour after you get it, we got to get it done quickly. RN check vitals the first 15 minutes is also right. UAP check the vitals before initiation. Yeah, before you start, UAP can start the transfusion. It can check the vitals before you do the transfusion, but after the transfusion started, 15 minutes done by the RN. LPN will monitor blood. Okay, after 15 minutes, yeah, RN can delegate to LPN. And this is prime. RN prime the tubing with LR. No, you use normal saline. So this is wrong. Y connector tubing was used. So this is good. And two client identifier were used. So these are all appropriate function. The only things that one. So those are the things they may ask you. By all means, if they're doing blood transfusion, they may ask you about it. Okay. So now we're able to make appropriate assignment. The blood is going, and then 10 minutes during the transfusion, 10 minutes. What has happened to the patient? What is the diagnosis for this patient? Right? What is the diagnosis? This is consistent with what? Acute hemolytic reaction. So this is acute hemolytic reaction. And if that's the problem, which of the following steps is appropriate? Or order these steps. And let me see. Order the steps. Number one, order the steps. What do you think? What is the most important? The first one, 1, 2, 3, 4, 5, 6. Which of these should be the correct order? Is it number 1, 2, 3, 4 is number one? Or number 5, number 6, number 7? What is the most appropriate order for this particular patient? What is the order of? This is all content, but at the same time, you have to think about issues that is happening to the patient and what you need to do to be able to figure out. If you know the disease process, then ordering it is not that difficult. So what do you think? How would you order it? At least when somebody is getting sick, stop the poison, right? Number 5 is number 1. Just so stop the poison. So this is number 1, right? Then you get to infused with normal saline to flush them, to keep their vein open. Okay, so 6 will follow that. Then you let the doctor know, number 4. So 5, 6, 4 is the next appropriate function. Then after you let the doctor know, they probably will give you vasopressin, right? You probably will obtain a urine specimen to confirm the problem. You document the finding, and then you send the blood back. So this is the order. This is the way you go. 5, 6, 4, 7, 2, 3, 1. So this is the way. Whenever there is a transfusion reaction, this is where you go. You stop the transfusion. You start infusing IV fluid. Let the doctor know. Okay. He'll give you the order for that. Get a urine specimen. Document the finding. And you send the blood back to the blood bank to figure out what is going on. So there's a new graduate standing there, asks you, okay, doctor, nurse, what is going on? I need you to tell me the difference between this kind of transfusion. I need to master them so that I can figure out next time. Okay, it's anaphylactic. Okay, anaphylactic reaction. So if it's anaphylactic, it look like allergy, right? Allergies are the things that causes hives, right? So right away, I know this is hives problem. That is the easy way to do that, right? They are the one that causes skin manifestation, right? Fever, febrile. So that means fever problem. So it's just only fever here, fever and chills. You don't have to memorize it. Fever and chills. And this is the skin reaction here. You see, that's the way you can break it. I see malaise is related to fever. Anaphylactic, you don't have malaise. Then you see angioedema, hey, anaphylactic here. You see, so complete the rest of it. Another clue is frank pain. If you get back pain, it's mostly hemolytic problem. If you get back pain, so that's hemolytic problem. If you're wheezing, think about it. The only people that wheeze is if they have allergic reaction. So that goes the anaphylactic. And dyspnea on exertion is anaphylactic. It's an airway problem. You see, you don't have to memorize. Dark urine means the blood vessels is breaking down. So it has to be hemolytic. And of course, hypotension. You become hypotensive if you have hemolytic problem and if you have anaphylactic. This is the way the table would look like. Okay. While the resident was poking, the fellow, the new graduate said, well, I still don't understand. You have to explain to me if the patient become anxious. Okay. Patient become anxious and he start having shortness of breath, some crackles in the lung base, blood pressure up, and they have JVD, it has bounding pulses, edema. How would I call this when the patient is getting transfusion? These are bad rates. This is what you put in the case. The patient is getting transfusion. All of a sudden, I call this bad rate. Connect the dot. I'm anxious. I have shortness of breath. I have crackles in lung base. My blood pressure is up. I have JVD. I have bounding pulse and peripheral edema. Blood pressure, JVD, bounding pulse, and peripheral edema, and you're getting blood transfusion, you should go and look for it. That's your homework. This is what we call TACO. And so go look for this, read about it, and see what exactly is this. Okay, so that's the problem. Basically, the patient need to be like in a half power position. You need to weigh them. You need to check in and out, and then you need to give them diuresis, furosemide. So read more about it and figure it. This is not heart failure. This is what we call TACO. So read more about it and figure it out. Okay, those are the signs and symptoms you need to learn about. So before we end, this is what happened. They checked their hemoglobin again and they did a hemoglobin the analysis. Okay, that's a sickle cell. Patient was discharged home, came back. So we discharged the patient home, came back 2 weeks later. with severe bone pain, the doctor thinks the patient is in crisis, vaso-occlusive crisis, right? Which of this is indicated? PRN transfusion may be, that's needed, right? MPO is wrong. There's not supposed to be MPO. We want to hydrate them, so not indicated. What else do you think? IV hydration, excellent. It matches if I'm not MPO after. My pain is going to be severe, so I need to have PCA. What about the last three? What do you guys think? What do you want to do with it? What do you want to do with it? Hydroxyurea, compression stockings, and cold compression. Are they indicated or not indicated? I can tell you this is always a trap. When you give them cold compression, it causes vasoconstriction. You don't want vasoconstriction in these patients, so not indicated. This is also the same thing here. Constrictive clothing will do the same thing as cold compression, so this is not indicated. And hydroxyurea is for long-term problem. This is an acute problem. She's in crisis, not indicated. Anybody will give you a sickle cell question. If they don't give you these answers, it's not a true good answers. So I've given you all the things that you should expect in a case of a sickle cell. Okay, in the case of a sickle cell patient. And so they admit the patient, they did everything for this patient, right? They did everything. And the nurse did an observation assessment and found this on assessment. She's been admitted, she's in crisis. Which of this is concerning to you? These assessments, which of them is concerning? Tell me. Enlarged spleen, bone pain. Of course, these two, knee pain, bone pain, is an expected finding for somebody in crisis. Go for the, when I ask you which is concerning, go for the unexpected finding, right? The hand and swelling is expected finding for sickle cell patient. A hemoglobin of 8.5 is expected. Okay, she's in crisis. Why are you worried about it? It's all expected. So this is expected, 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 expected. Reticulocyte count, yeah, it's also expected. Sickle cell patients should not have a big spleen. If they have big spleen, that's a problem, right? So the only thing that was concerning is that one. 1, 2, 3, 4, 5, 6. It's all traps. And so, of course, you got to pick those that you know. In your NCLEX, if they say which is concerning, they give you options. A select or apply. Don't pick, over-select. Pick those you know. If you know only one, just pick it. Don't over-select. So the only thing that was concerning was what? Leg, spleen enlargement. And then finally, she developed a DVT, unfortunately. She developed DVT. Okay, and they put it on heparin drip. 2 days later, a platelet, which was 20,000, is now down to 50,000. What is your diagnosis? I'm not telling you the diagnosis. You have to tell me this is indicated or not. So this is heparin-induced thrombocytopenia. If you know this, then what is your management? Which one is indicated or not? It's heparin problem. We got to stop the heparin. Of course, we're going to check some lab. And Enoxaparin is also heparin. You don't need it, right? So this is wrong. So let me clean it. So one, you don't need to. So Enoxaparin. So we check lab, we stop heparin. We're going to do neuro checks. We don't need to do anything about fresh living vegetables. And we're going to start the patient on dabigatran. And the Enoxaparin is the same as heparin. So this is right, this is right, this is right, this is right. These are all indicated, 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 indicated. And this is not indicated. This is not indicated. So that's the end of the case.